A total of 129 suicide cases have been recorded in Zimbabwe from the period extending from January to March in 2019, which is an increase from the 91 that was experienced the same time last year. This is Topical Conversation, and I'm Margaret Matibiri. Today on the show, I'm joined by Dr Jabangwe, a university lecturer at the University of Zimbabwe in the Psychology Department, to talk more on the issues of mental health. Doctor, welcome to the show.
Thank you, Margaret. I'm quite delighted to be invited to contribute to this topical conversation.
I am meant to understand that you have been serving in the Department of Psychology for the past 16 years. In your professional opinion, what do you think are the causes of mental health which consequently lead to suicide?
Okay, thank you, Margaret. There are quite a number of issues that lead to mental health challenges. Other than the genetics, some people might be born with a predisposition to mental health challenges, but there are quite a number of things that also lead to things like depression and anxiety, and amongst these would lead to loneliness, hopelessness, and the inability to find a system to fall back on.
So lately there have been so many reports of young people committing suicide. For instance, we have the issue of a teenager who recently committed suicide, and there have not been any explanations as to why she committed suicide. Before that, we have the issue of a high school pupil who also committed suicide, and before that there was also the issue of a pastor. What do you think can be done to ensure that these high rates of suicide are contained?
Okay, thank you. The most critical aspect is not necessarily to be reactive, to react to the episodes. But what we need to do is to put in place a robust prevention infrastructure. That is very key. So as a country, we really need to have a multi-stakeholder framework where different professions and different stakeholders, including the government and the parent ministry, put together a task force to look into mental health and to also ensure that we also have institutions put in place and capacitated to be able to respond timelessly to the mental health issues. Key also is the issue of screening. People need to be screened for possibilities of mental health. It could be depression, it could be anxiety, it could be schizophrenia. So screening is important. So we need evidence-based intervention. So in that regard, we need to really be in a position to provide the statistics of who needs help and the extent of help required.
Okay, so it is a given that the younger generation have engaged in premarital sex earlier than other generations before that, which has led to a lot of unwanted pregnancies, and we have had cases of children giving birth when no one is suspecting that they're actually pregnant, which eventually leads to other students committing suicide. What do you think should be done from a societal point of view to ensure that everyone is accommodated where issues of mental health are concerned?
Okay, thank you. Community-based interventions are the starting point. So we need to engage our different stakeholders at the community level and ensure that they have the buy-in in terms of the different interventions that we would like to put in place. You would also notice that we also need to create awareness. We need awareness campaigns where to raise the awareness of the community in terms of identifying the risk factors. What identification of the risk factors is an important point, because once we are able to identify the risk factors, we can then be in a position to intervene and save lives. So it is very key to really create awareness in the community in terms of what is it that they can do to assess the risk. And then other than that, the community also needs to be assisted to be able to respond and to respond positively. We need responsive ways so that we create a platform where those that may be in need can actually get the services without feeling apprehensive or without feeling being judged.
Zimbabwe is such a religious nation where we see a lot of people tending to their religious leaders for assistance. But at times, it doesn't seem like these religious sectors offer adequate psychological help. What has your faculty done in a bid to accommodate everyone in society who is going through psychological issues?
Okay, thank you. Recently, we launched the Friendship Bench in collaboration with Professor Dr Jabangwe at the University of Zimbabwe to provide the much-needed assistance to our students. And that is meant to ensure that our students have help on their doorstep. But just this week, we've also gone a step further as the psychology fraternity. The Zimbabwe Psychological Association has put in place a suicide prevention helpline, which, if possible, I could give to the viewers. And the helpline, this is a toll-free helpline. It's 0772 571 656. So this is the realization by the psychology fraternity that we need to make a difference. We need to augment what other stakeholders are doing. So we are actually into this together with the psychology fraternity.
So what do you think needs to be done in terms of policies where mental health is concerned? Because, for instance, we have so many awareness campaigns on HIV and AIDS and many other social ills that people go through, and we do not seem to have an environment that accommodates mental health without stigmatizing the ones who are suffering. What do you think needs to be done? What type of policies would you recommend that be put in place?
Okay, I think the start of any policy is research. We need evidence-based intervention. So the starting point is that we need to be in a position to work with different stakeholders to put up research that can give us indicators in terms of the different mental health problems people have and the need areas. And that should be a nationwide survey to focus on what people's needs are and what type of assistance is currently available. That then will inform the interventions. We need to cascade those interventions to the community level. And it is only when we have that evidence that we are able to come up with policy briefs. We need to engage the legislators. We need to engage even the Parliamentary Portfolio Committee on Health through the parent ministry. Like right now, we have a directorate on mental health within the Ministry of Health. And I think those are the people that we need to work with so that we come up with robust mechanisms for assisting.
In your own view, do you think psychological services are affordable to the general public in Zimbabwe at the moment?
Well, not really. They're not really that affordable because to the general public, that's why you would notice that, like right now, I think the rates are maybe the equivalent of about $50 US per session. We are looking at a 1 hour session. But other than the cost, I will also look at whether people are aware that psychological services are there. So people generally would not be aware that there are psychological services. So that's our starting point. We need to create awareness. We need to create demand for those services. And in so doing, we are also able to let people understand what are the different strands of psychology available. We have clinical psychology, we have community psychology, we have industrial and organizational psychology, we have forensic psychology, we have engineering psychology, we have counseling psychology. So people need to understand what each of those entails so that they realize where to go when they have a particular psychological need. In addition, you would notice that there's also need to avail the directory of service providers, and our regulator, the Allied Health Practitioners Council of Zimbabwe, has a directory of those that are registered to practice. So it is also important to understand that people also get assistance from those that are properly regulated with practicing certificate.
What has stopped players in your sector from making sure that these services are well known to the general public? Because I would be lying if I said I had someone saying they were seeking psychological help. What has stopped your department from advertising the services they offer and how best they can assist our communities today?
Okay, you would reckon that psychology is protected by an act of parliament. Psychological services are not advertised per se. It is unethical to advertise. So, but you need to create awareness for the need for those services. So it's different from a supermarket that can advertise and say, we are the best. There are things that are prohibited at law. But we are looking at the different guidelines regarding marketing of services, and I think it's still work in progress. We are also focusing on collaborating with other stakeholders, our like-minded professionals like the psychiatrists, to ensure that the services are there. As the Zimbabwe Psychological Association that we work with, and I'm in the council for the Zimbabwe Psychological Association, we are also working on ensuring that these services are available in various parts of the country, and we are going to have outreach programs to ensure that we get to the population.
But Doc, given the current statistics, is it still unethical for lack of a better term, to market some of these things, to tell people what can be offered where mental health is a concern? Do we have to get to a point where it becomes a normal thing to hear of cases of suicide before we put it out there that these services can be offered at certain places to deal with specific issues? Do you not think that it is about time?
Okay, indeed, it is about time. Like I think that's why I talked about the director of service providers. We need to create a directory of service providers and publish that directory. Once we publish and make it known and create that kind of awareness, then people know where to get the service. So we really need to up our gear in terms of that.
So, Doc, as we come to the end of the show, there have been many social media reports of the younger youths complaining on issues of depression, especially with the current economic situation in Zimbabwe. What would be your message to that one viewer who is watching this program at the moment and who is also struggling with mental health?
Okay. My take on that one would be, if you are feeling overwhelmed, failing to cope, planning on giving up, or seem hopeless, you need to get in touch with the providers. And I want to repeat the suicide prevention help line, and this line can also help you to get access to other services that the Zimbabwe Psychological Association has put in place. It's 0772 571 656. Get in touch and you will be assisted with the agency required.
Thank you very much, Doc, for joining us on the show.
Thank you so much, Margaret.
This was Dr. Jabangwe with the University of Zimbabwe, where he is a lecturer in the psychology department, giving an insight on issues of mental health, which consequently lead to suicide, saying that you are not walking alone. In the event that you need assistance, you should reach out, talk to someone and get assisted. And suicide is not an option. I am Margaret Matibiri, and this is Topical Conversation, signing out.